Go. Hi, my name is Peter Sill. I'm a current patient of Dr. Bao's for brain acupuncture. I walked into Dr. Bao's clinic about 8.5 years ago in May of 2001 in a very terrible state. Result being I was taking Parkinson's medication and as a result was suffering from what they call tardive dyskinesia, which is involuntary movements from the results of psychiatric medication. Fortunately, Dr. Bao, Dr. Xiang Yang Bao, the owner of Sunny Chinese Medical, was able to, was a specialist in brain acupuncture or cerebral acupuncture, and thank God he has been a saving grace to me and treated me for the last 8 years to now result in me being almost 90% mentally wherewithal. So when I walked in here in May of 2001, I was in an absolutely horrific state. I had just come back from UCLA and seen 6 top neurologists who had put me on a table and sort of prodded me like a dog. And they couldn't do anything for me, just wanted to send me home and have me take more medication, which is fine, but that's all that Western medication can do. Prior to that, I was suffering from spasms, involuntary spasms, and going to many emergency clinics over a year period, 2 or 3 times a week. Finally, one hospital within Orange County said the only thing they could do for me is to use electric shock if I showed up again. Of course, I didn't go back to the hospital thereafter. This all goes back to my childhood. I'm a very hyperactive person. During my younger years, I smoked cigarettes for about 6 or 7 years. Thereafter, I stopped smoking and didn't just remain hyperactive. Years later, I would become a workaholic, working tremendous hours as a teacher, and got tired. So I went to the doctor, and he decided to put me on medication because they thought I had ADHD, which because of my hyperactivity they said Ritalin would be a good idea. Initially the doctors didn't want to put me on Ritalin. I forced the doctors to put me on Ritalin, so it's actually my fault. So I went through Ritalin like nothing and went to the highest dosage at the shortest period of time, and Ritalin is an amphetamine, member of the same family of amphetamines. So I came to find out that Ritalin shrinks the brain. So unfortunately, the more Ritalin I took, the smaller my brain became. So Ritalin is a stimulant, so I took all the medications in the stimulants class, Adderall, Dexedrine, and then they put me on clonidine, which is the reversal of those medications. And then stopped taking medication for a year, and then found out I became chemically depressed, because I'd already exhausted all the stimulants and medication that doctors had to offer. So I then went on to SSRIs, Prozac, Zoloft, which are all serotonin inhibitors, re-inhibitor uptakes, whatever. Then I went to Effexor, Zyprexa, which is an antipsychotic, and there I went to dopamine medication. And dopamine medication is irreversible. Once you're on dopamine, you're considered to have Parkinson's and there's no way out. So one day I decided to stop taking the medication, and when I stopped the medication I had the worst side effects that any man could have. My head would go like this, and my head would go like this, and my neck was like this for a year. My back was not vertical, my back was horizontal for almost 1 to 2 years on end. I had an MRI done of the brain. Most neurologists couldn't read it. Dr. Bao read my MRI and he found out the main blood vessel in the brain, the cerebral cortex to the basal ganglia, was 70% closed. 70%减锁. So because of that, I found Dr. Bao by destiny's calling, and he started using acupuncture, putting needles in my head where I could walk around for months, being ambulatory, able to move. He bled me, used needles 4 times a week, right? First year, the evening. Right. 4 times a year, 4 times a week, and then did acupuncture and now I've been doing acupuncture for the last 8 years, 2 to 3 times a week without fail, and I'm now about almost 90% perfect. I pray to God that when I become 100%, I'll probably be too hyperactive, and my wife and everybody else will not be able to deal with me. Okay, but that's okay. I'm going to go for 100% anyway, so I'm 45 years of age. I feel like I'm 35 years of age, and thanks to Dr. Bao, I don't take any more medication. He had to wean me off Zyprexa to Wellbutrin, and Wellbutrin is lower than Zyprexa. Zyprexa causes pancreatic failure, Xiang Yang Bao. So Dr. Bao weaned me from from dopamine to Zyprexa to Wellbutrin, and then I took nothing, absolutely nothing. And people say I'm hyperactive and my attention span is lower. Actually, my attention span, Zui Li, is very strong, and I can study like anybody else and not lose concentration. So that is all ridiculous, 莫名其妙, to say that I am ADHD. 什么三心两意，我是三心三意. Okay, 有意. So, that was a joke. So I want to say thank you very much for this 3-minute speech, which became 8 minutes. Okay, so I'm very sorry that you can, but now, it's New Year's Eve. Everybody have a happy New Year for 2010. Thank you very much. 新年おめでとうございます。新年快乐都可以. And then thank you very much. Have a good evening. And if you have any problems, you can come to Sunny Chinese Medical. And
这些年你
OK，
这些年我都每天很快乐。
这些年你就是什么不好的非常健壮了，每天工作都什么问题都没有了，是不是？
Well, I'll put this down. Dr. Bao can check your pulse, look at the color of your tongue, even read your MRI, even read your CAT scan, and tell you what stage of cancer you have. If it's breast cancer or whatever cancer, gallbladder stones. If you can't get pregnant, there's a reason why. He'll tell you what to do, where to do it, how to do it. 状况、情况, and 轻轻松松说下来. Okay. Thank you. Have a good evening. Bye bye, everybody. Thank you.